Malaria is a life-threatening disease caused by parasites that are transmitted to people through the bites of infected female Anopheles mosquitoes. It is preventable and curable. According to the World Health Organization, 27% of all cases of malaria and 32% of deaths globally occur in Nigeria annually. The country holds an unenviable position of the world's greatest malaria burden. Eradicating the disease, mostly affecting children under 5 and pregnant women, has remained daunting for the country.
In spite of the steady progress to date, we are yet to meet the coverage and impact targets we set out to achieve for malaria elimination. One of the main challenges to attainment of these targets is insufficient funding for interventions at national and sub-national levels.
Year in, year out, Nigeria will be needing about 420 billion, but what does this translate to per capita? It actually means we need just 2,100 to save a life in Nigeria every year. That's about $5. And that's what we're seated in.
To help oversee the country's journey towards malaria elimination and ensure that sufficient resources are available to achieve it, President Muhammadu Buhari inaugurates Nigeria End Malaria Council, a high-level council of individuals from the private and public sectors. He projects that the successful implementation of the council's agenda and savings from the estimated economic burden of the disease would save Nigeria 2 trillion naira by 2030.
The End Malaria Council will provide a platform to advocate for more funding to protect and sustain progress made so far by our country and put us on a pathway to ending malaria for good. The successful implementation of the Council agenda will result in improvement in the quality of life, health, and well-being of Nigerians by providing impetus for malaria elimination and by saving about 687 billion naira nationally, which is the estimated economic burden of malaria for 2022. The savings could increase to 2 trillion naira in 2030.
President Buhari also reveals his choice of Dangote, Africa's richest man, as the chair of the 16-member council.
I believe he will also bring his outstanding achievements to bear in this cause to help our country achieve its goal of malaria elimination.
Accepting the responsibility, Aliko Dangote promises to galvanize the private sector commitment to deliver on the mandate.
Together, we will work hard to ensure that malaria elimination remains high on Nigeria's agenda with strong political commitment from leaders at all levels. We will advocate at the national and state levels to ensure sufficient funding for malaria elimination.
African leaders aim to eliminate malaria from the continent by 2030. The success or otherwise of Nigeria's strategy to completely eradicate malaria, experts say, will depend largely on efforts to curtail the breeding of the vector, to include improved personal and environmental hygiene by all.